Welcome back to Dr. Health Tips. We focus on our seniors in the United States. Have you ever looked at someone your own age, or your own reflection, and noticed a slow change? Not in strength or memory, but in spirit? Maybe she used to laugh more. Maybe he used to join gatherings. But lately, something feels quieter. You're not alone. 1 in 3 Americans over age 60 experiences symptoms of depression, and 1 in 5 shows signs of chronic anxiety. Far too many seniors silently battle isolation, sadness, hopelessness, even when everything looks okay on the outside. But here's the important truth: your emotional health matters just as much as your physical health, and it is treatable, manageable, and worthy of attention. Today, we're talking about depression and mental health in American seniors, how to spot the signs, understand what's happening in the brain, and discover gentle, practical paths to beginning healing. Why this matters for U.S. seniors. Aging in the United States comes with challenges many younger people would never expect. Isolation after friends move away or pass on. Retirement that leaves identity unmoored. Chronic health burdens that drag on mood and energy. A slower pace of life can easily lead to a shrinking social world, and when our routine narrows, our emotional resilience often follows. Medical stats show older adults with depression have higher hospitalization rates, slower recovery from illness, weaker immune systems, and even a doubled risk of heart disease or complications. This isn't just sadness, it's a health risk. And unlike the depression we hear about in younger adults, quiet seniors may not say "I'm depressed." They just withdraw, lose interest, and say, "I'm tired." The good news? Understanding this as a health condition, not a moral failing, is step 1. Treatment works. Support works. And many seniors see remarkable improvement by honoring their emotional lives just like they honor their physical ones. Behavioral sign number 1, loss of interest in everyday activities. Mrs. Thompson used to host game nights. Now she rarely answers her phone. Mr. Jenkins once loved gardening, but now the backyard sits empty. This isn't laziness. It's often one of the clearest emotional signals. This sustained loss of pleasure or interest, called anhedonia, is a clinical hallmark of depression. It shows that the dopamine, the brain chemical tied to pleasure and motivation, is dampened. When joy fades from previously rewarding activities, the heart and mind signal that something deeper is going on. In American senior surveys, this is one of the most commonly reported symptoms, even when energy and sleep appear normal. If someone you know simply stops caring for hobbies, pets, social visits, or family calls, that's a red flag. Behavioral sign number 2, persistent sadness or hopelessness. It may not be a dramatic sobbing cry. Instead, they may say, "I just don't feel like myself." Or "I'm bored all the time." For many seniors, a disconnection from hope, feeling like the circuit breaker inside isn't fully turning on, is painful but quiet. Unlike situational grief, this low-grade sadness doesn't necessarily point to an external reason. It can form in the absence of noticeable triggers, often fueled by low vitamin D, inflammation, sleep debt, or micronutrient gaps. In older adults, this emotional slow fade is often mistaken for natural aging. Behavioral sign number 3, changes in appetite and weight. This one's tricky. Some seniors lose weight without trying, food doesn't taste as good, or reduced appetite takes hold. Others gain weight due to fatigue and inactivity. Either direction, weight loss or gain, can be a mental health signal tied to depression, changes in serotonin levels, or disrupted hunger cues. When you combine appetite change with other emotional signs, detachment, fatigue, sleep disturbance, it becomes easier to see the puzzle as one holistic condition, not isolated symptoms. Behavioral sign number 4, sleep changes, too little or too much. Have you noticed mom sleeping all afternoon, or dad waking up at 4 a.m. and staying in bed all day? Imbalanced sleep is common in senior depression. Insomnia may present as early waking or restlessness. Hypersomnia, oversleeping, may mean exhaustion is overwhelming. Either disrupts the circadian rhythm, which in turn worsens mood, inflammation, and cognitive clarity. A senior's healthy sleep schedule often includes a refreshing nap, but when that nap becomes hours long or is followed by late-night insomnia, it becomes a cycle that amplifies emotional dysregulation. Right now, you've seen 4 of the most common but under-recognized warning signs of depression in seniors: loss of interest, persistent low mood, appetite changes, and sleep disruption. Each by itself may feel small, but together they point to important shifts in brain chemistry and mental resilience. Coming up next, we'll cover signs 5 and 6, like slowed thinking or loss of focus, and physical aches or pain with no clear medical cause. Then I'll share a compassionate, practical toolkit for seniors, including supportive communication tips, lifestyle shifts, medical steps, and emotional recovery strategies specifically designed for older adults in the U.S. Stay with me. I promise this is about hope, renewal, and real ways to strengthen both mind and body, starting today. Stay in touch and keep watching, and don't forget to subscribe our channel.